morning. I am here in the control room to read some papers. Today's paper comes from the Herald Scholarly Open Access Journal of Community Medicine and Public Healthcare, and it is, let's see, date December 8th of 2022. Published the December 22nd. The expanding spectrum of onset rheumatic disorders following COVID-19 vaccination. And so look at the date. So this was coming out, 22. We're in 24 now, I believe, aren't we? I'm not sure. Yeah. An abstract. So the vast majority of immunization patients have no safety issue. Let's make sure that's out of the way. But that does not detract from the reality of numerous peer-reviewed publications, reporting on a wide variety of new onset vaccination-induced disorders. Case reports such disorders have implicated more than a dozen different vaccines, and the illnesses they initiate typically comprise two distinct categories: one, autoimmune and autoinflammatory diseases, and two, neuropsychiatric ailments, whose overlapping clinical features often mimic what is characteristic of the various neurological fatiguing syndromes. Over the past 2 years, amelioration of morbidity and mortality from SARS-CoV-2 infections has been a worthy goal of the new COVID-19 vaccinations. Thus far, publications reports of chronic adverse reactions to COVID-19 vaccines has encompassed either new onset category 1 disorder, excuse or exacerbations of pre-existing autoimmune disorders. So it's either bringing on new ones or it's making the old ones worse. Observations reported herein expand this spectrum of chronic adverse reactions to category 2 and simultaneously offer novel potential mechanisms of disease causation. So here's some of the keywords. We got autoimmunity, COVID-19, fibromyalgia, rheumatic disorders, SARS-CoV-2, and vaccines. I think I can probably only say about 3 of those things. And most of the time. The introduction. Intense controversy has been granted over the past 4 decades by published reports of an ever-expanding list of chronic vaccination-induced disorders that exclude anaphylactic and acute allergic reactions. In the aggregate, these publications have raised more questions than answers due to the following observations. A, any single vaccine appears capable of initiating a wide variety of well-organized autoimmune and/or autoinflammatory conditions. B, on the flip side, any single autoimmune or autoinflammatory disease may be triggered by a wide variety of different immunizations. And C, autoimmune and autoinflammatory disorders do not solely comprise of all of the reported diverse vaccination-induced disorders, because it is now appreciated that chronic ailments manifesting overlapping features of various neurologic fatiguing syndromes may also be triggered by various immunizations. D, considerable heterogeneity exists regarding the chronological onset of vaccination-induced disorders, spanning 24 hours to 4 weeks. E, the vast majority of vaccine recipients do not develop chronic ailments. F, the presence or absence of post-vaccination autoantibodies directed at a perplexing array of self-antigens in any of the above scenarios are extraordinary, inconsistent, and at times their appearance may conflict with the known chronological sequence of the adaptive immune response. G, chronic inflammatory reactions at the inoculation site itself appear capable of the eventually triggering systematic inflammation. Just think of that, just in the reaction of the shot in itself is capable of eventually triggering systematic inflammation. And some investigators claim that optic neuritis, abrupt hearing loss, thyroiditis, and autism should be added to the list. The presence or absence of mercury and aluminum additives, as well as their varying vaccine concentrations, create too many co-founding factors for definitive analysis. And J, spontaneous improvement and or favorable responses to varied treatment regimens are inconsistent. For example, IV and anti-inflammatory drugs, alternate medicine modalities. Despite these observations, some proponents of chronic vaccination-induced disorders continue to force-fit afflicted individuals into single theories of disease causation, such as a molecular mimicry and ASIA, autoinflammatory syndrome induced by adjuncts. Not infrequently, this has elicited stinging rebuttals by autoimmunologists, toxicologists, prominent clinicians, and the government officials who oversee the National Vaccine Injury Compensation Program. Molecular mimicry controversy becomes significantly muted whenever Guillain-Barré syndrome, or GBS, Guillain-Barré syndrome, rheumatoid arthritis, or systematic lupus, I'm not going to be able to say that name, erythrem, you can read it, legitimately develop after influenza vaccination. But that does not diminish the clamor of naysayers for all of the alleged chronic ailments attributed to a diverse array of immunizations. Over the past 2 years, this controversy has been dramatically enhanced by the introduction of vaccines and ameliorate the COVID-19 pandemic caused by SARS-CoV-2. Published reports of alleged new onset COVID-19 vaccination-induced disorders include systematic lupus, and there's that word again, rheumatoid arthritis, vasculitis, myositis, probably, Guillain-Barré syndrome, thrombotic thrombocytopenia, myocarditis. Man, once my tongue gets lost, it's really hard to find again. Optic neuritis, multiple sclerosis, autoimmune hepatitis, and IgA neuropathy, and even death. And the following 3 case histories expand this controversial list because their clinical features and chronological evolution differ substantially from vaccination-induced autoimmune diseases. And here it goes on to talk about some case reports. We have a case report of a 46-year-old female who had previously received dozens of immunizations without any incidents, including typhoid, yellow fever, and influenza. But in March 2021, she received the first dose of the mRNA Moderna COVID vaccine, following 4 weeks later by a second dose of the same vaccine. The first dose produced chills and myalgias, which resolved 48 hours later without the reoccurrence of any adverse symptoms following the second dose. The booster dose was administered in November 2021 without any incident. But then 1 month later, she contracted a mild self-limited infection caused by it. So she got sick with the COVID, even after the multiple loosey-goosies, without lower respiratory symptoms and without any change in taste or smell. A complete resolution of upper respiratory symptoms, headaches, and fatigue occurred within 7 days, and she did not experience any long hauler symptomology. In earlier June, she received a second booster, which was her 4th dose of the COVID Moderna vaccine. In the first 48 hours following this dose, she developed She developed these things again, and fatigue, which continued unabated. And 1 week following the second booster, she developed a deep aching in all of her muscles and lower extremities, described by the patient as electric sensations, accompanied by tingling and weakness in her lower extremities. She took a test at home and it was negative for COVID-19. She was not pregnant with COVID-19. The symptoms became progressively more severe to the point that the mechanics of movement in her lower extremities felt like someone was controlling her leg. 5 weeks after the second booster, she developed parenthesis in her upper extremities, a weak urinary flow, POTS, postural orthostatic tachycardia syndrome, non-restorative sleep, and parabordial electric sensations with a normal examination of that thing there. She has a few other problems, and all of the above continued on a daily basis. 1 month after, she noticed abnormal gurgling and loose stools, followed shortly after by cognitive dysfunction, encompassing problems with word recall and name recall. There was no history of fever, rashes, adermia, or anything like that. And the chronological evolution of this illness prompted a multitude of inpatient and outpatient evaluations by neurologists and other subspecialists. Let's see. A bunch of things were ruled out by her doctor, including an inflammatory systematic connective disease, which is where I ended up finding this. I was doing some research about Ehlers-Danlos syndrome and connective tissue diseases, and what happens when they get shots, which I already know, but that's why I was going to see what the new papers were saying. 4 months after the onset of this systematic illness, she began to undergo partial improvement following an institution of acupuncture. Then we have a second case. You're going to see it's pretty similar. That was a 52-year-old white female with an 11-year history of psoriatic arthritis. And and she also had a reaction. There's another one of somebody who had benign hypermobility variant of Ehlers-Danlos manifested by, which is what these are. These are the symptoms. There is no accompanying event of cardiac involvement, no widespread pain. So she had this, a benign, it wasn't active, but prior through age 14, when she received her first Gardasil 9 immunization, HPV vaccine, a rare of previous vaccinations had been administered without incident. So they were able to get vaccines and not have any problems as of yet. Their system was just letting them jab themselves repeatedly and wasn't having a response. But one day after the second dose, she develops fatigue, headaches, and dizziness, which follows for the next several weeks with heart palpitations, chest pain, some blurry vision, some joint pain, nausea, and vomiting. She again has non-restorative sleep, broken sleep, and abdominal bloating. She is now a victim of the hypermobile variant, and a third was never given to her. In the first half of 2021, she received 2 consecutive doses of Moderna COVID-19 vaccine with no problems. But in March of 22, while feeling well and readily participating in all aspects of her college, she received a booster dose. And within 24 hours, she became abruptly ill again with the reappearance of the chronic fatigue, headaches, dizziness, followed by shortly thereafter by daily reappearance of all other phenomenon listed above. So she started to get a problem. The discussion goes like this. And then it says, but none of these three individuals had a family history of rheumatoid disorders. It's just showing up. So the discussion says, if one accepts the reality of chronic vaccination-induced disorder, how can they be so diverse? It is scientifically sound to acknowledge new onset post-vaccination autoimmune rheumatic conditions because these diseases appear to be mediated by cross-reacting autoantibodies that shared demonstrable antigenetic specificity. Specificity part. You know what I'm trying to say with vaccine component. I hadn't even been jabbed. I have no excuse. The scenario is not relevant to Gardasil recipients nor to the three individuals in this report, as both groups demonstrated chronic post-vaccination ailments mimicking the clinical features seen in one or more of the neurological fatiguing syndromes. Two questions come to mind. A, why do individuals with spontaneous idiopathic onset neurologic fatiguing syndromes, chronic fatigue syndrome, myalgic encephalomyelitis, fibromyalgia, small fiber neuropathy, dysautonomia, POTS, and complete complex regional pain syndrome? So it says, why do individuals with spontaneous onset of fatiguing syndromes, and that was a list of the fatiguing syndromes, why did they demonstrate multiple similar overlapping clinical phenomenon to each other in the first place? Why? Of course. And B, are observations of immune dysfunction, cytokine elevations, and viral detection in neurologic fatiguing syndromes actually causative, or are they simply secondary circuitous amplification loops that arise well after the onset of primary biochemical disturbances caused by an increasing environmental chemical contamination? After all, 60 years ago, neurological fatiguing syndromes were vague and rare, and now they are vague and common. The above questions are relevant not only for the complexities inherent to the idiopathic onset of neurologic fatiguing syndromes, but they are equally relevant for the clinical diversity seen in autoimmune vaccination-induced disorders triggered by Gardasil and COVID-19 vaccines. These queries require us to consider multiple other overlapping and independent mechanisms of disease causation operative in these two vaccine groups. Organ siloxanes, I don't know how to say that, but you can read it there. Vital organic compounds like benzene and these derivatives and ethylenes are some of the hidden chemical ingredients present in Gardasil and COVID-19 vaccines. Perinatal exposures to these additives at the time of immunization are capable of initiating a myriad of biochemical disturbances encompassing, but not limited to, A, mitochondrial. Whenever I'm listening, people read things, and we all do the same thing when we laugh because we're a little bit uncomfortable that we feel somewhat stupid for a second, and two, we all go so when you're listening to obviously a natural thing for us to do when we can't read something. Chondroial, there we go, dysfunction, with or without DAMPs. And DAMPs stands for damage associated molecular patterns. B, metabolic anomalies. C, transcriptional aberrations with or without epigenetic alterations. D, reactivation of previously acquired viruses. That's very interesting. Remember, these viruses hide inside and pop their heads back out sometimes. Once you've got it, you've always got it. microbiome alterations, disturbances in cellular impedance, G transmitter disruptions, H biointegration into matrix macromolecules, I changes in the cell membrane permeability, and J mast cell dysfunction, mast cell activation syndrome, MECAS. You'll see that being used soon. The latter producing secondary activation of brain microglia cells to trigger neuroinflammation. And to facilitate and amplify such biochemistry disturbances, it would be necessary to theorize the coexisting presence of individual adherent anomalies such as reduced hepatic or the P450 enzyme activity towards xenobiotics, innocuous inborn channelopathies, and altered regulatory T cell function. The required convergence of such multifactorial phenomenon can explain why chronic non-immune vaccination-induced disorders are infrequent, why diverse disease manifestations are diverse, and diverse disease severity exists in affected individuals, why time to disease onset is variable. So how come, that again, something that can cause it to not be noticed, because sometimes it happens 2 months later and sometimes it happens 2 minutes later. Why there's a broad variability regarding the exact number of vaccine exposures required to initiate the symptoms, and why the population is at risk for such occurrences is not dependent on familiar autoimmune diathesis. However, once such a disorder is underway, all of the above causation participants and biochemical disturbances may then foster the delayed production of multiple autoantibodies, which in turn can create secondary amplification loops that circuitously augment and chronically perpetuate the initial acute adverse reactions. These latent events are compatible with the normal chronological evolution of adaptive immune responses, and therefore these autoantibodies would not be the initiators of this type of vaccination-induced disorder. Hence, the proposed non-molecular chronic new onset. So here's the title. So now, hence the title, the need for this title, chronic new onset non-autoimmune rheumatic disorders following a COVID-19 vaccination. Parallel events stemming from worldwide contamination of multiple environmental compartments by the same chemicals coupled with the same innate anomalies could theoretically initiate and then chronically perpetuate many neurologic fatiguing syndromes. Multiple autoantibodies have already been identified in several of the neurologic fatiguing syndromes, especially POTS, regarding whether or not such syndromes have been vaccine triggered. These antibodies can be directed at any part of the nervous system, including sensory nerve receptors. And it gives you some other things, for examples, motor nerve receptors, autonomic receptors, dorsal root ganglia channel proteins, and even in the brain. These pathophysiologic constructs for chronic non-autoimmune vaccination-induced disorders have previously been referred to by this author as a, quote, perfect storm. And the same publication has also pointed out uncanny resemblance between chronic COVID-19 vaccine-induced ailments and the phenomenon manifested by COVID-19 long haulers or long COVID. So Lucy juice or the cold both had an effect on you. following SARS-CoV infection. Such resemblance have recently been verified by researchers at Yale School of Medicine. The same researchers have been studying the presence of or absence of autoantibodies and other immune abnormalities in both conditions. And with future intent to expand this study by searching for non-protein directed autoantibodies in both conditions. However, vaccination against SARS-CoV appears to have a double-edged sword, as a recent publication has reported on a paradoxical appearance of immune suppression following COVID-19 mRNA immunizations, reconciling all of these, all right, with post-COVID-19 vaccination-induced myocarditis, and we know all about that, and the systematic connective tissue disorders. It seems to be a tall order. Attorneys who participate in the National Vaccine Injury Compensation Program have been besieged by thousands of chronically ailing post-COVID-19 vaccine recipients manifesting a variety of legitimate, temporarily related new onset post-immunization complaints, characteristic of the overlapping clinical features seen in one or more of these fatiguing syndromes. These individuals represent a serious emerging public health issue, a serious one that warrants both formal recognition and coordinated research endeavors. One example worthy of such research is the known suppression of liver's cytochrome enzyme system. It's present in both Pfizer and Moderna vaccines. This PEO is also present in Moderna. Individuals inherently manifesting reduced baseline metabolism of xenobiotics could be further compromised after the immunization with either one of these vaccines via enhanced persistence of various other toxic chemical ingredients present in these two products. And a full list of mRNA vaccine ingredients is found. It's these kind of things that make me wonder why it suddenly is so prevalent in younger generations. Could it possibly be, according to this paper, the amount of vaccines, the amount that are giving to the children nowadays compared to when we were kids, and what its layered effect is. So the conclusion says that vaccine development continues to expand, fostering in large part by 3 years of COVID-19 pandemic caused by SARS-CoV infections. This in turn has heightened the long-standing controversy over new onset vaccination-induced disorders, because these disorders now also encompass the COVID-19 vaccines themselves. The long-standing theories of the mechanisms of disease causations in these genuinely novel scenarios continue to be overly simplistic, in a large part due to the ever-expanding magnitude of conflicting observations and the ever-expanding cocktail of vaccine ingredients. The needs for pathophysiologic reanalysis of these theories is further reinforced by emerging diversity and perplexity of the new onset rheumatic disorders that are triggered by the Lucy juice. And here are a lot of references. I'm going to read some of the titles in case you want to go look them up yourself. Some of them I might be reading also, but I thought the titles really just kind of say it all. This one was from 2017, so we're actually going back pre Lucy juice. The vaccination and autoimmune disease is prevention and adverse health effect on the horizon. And so that sounds like a very interesting paper. This one says, why are vaccination-induced rheumatologic disorders so diverse? That was in 2020. In 2015, we had a paper revisiting adverse reactions to vaccines, a clinical appraisal of autoimmune syndrome induced by adjacents of the Asia. Sounds like a good one. The new onset of another 2022, the new onset autoimmune phenomenon post-COVID vaccination. That was in an immunology article. Here's one that's not listed, but it says audio antibodies, antibodies induced by the vaccine. That was from 2015. That one's not available anymore. That's curious. The expanding cocktail of harmful ingredients in the human papilloma virus vaccines, or HPV. 3 decades of autoimmune tunnel vision directed at breast implant illness, neurologic fatiguing syndromes, and vaccination-induced disorders. The perfect storm relationship between vaccine-induced disorders and illness manifested by post-COVID long haulers. And then you've got the hidden toxicity of human papilloma virus HPV vaccine ingredients. Vaccination-induced diseases and the relationship to neurologic fatiguing syndrome, channelopathies, breast implant illness, and autoimmune biomolecular mimicry. You've got autoantibodies against autonomic nerve receptors in adolescent Japanese girls after their immunization of HPV. That was in 2019. This one is, let's see, that one just has a paper, doesn't have a title. Distinguishing features of long COVID identified through immune profiling. Innate immune suppression by CoV SARS mRNA vaccines, the role of G quadruplexics, exosomes, and microRNAs, food chemical toxicity, toxicology, inhibition of these P450 enzymes, and the neurological and psychiatric risk trajectories after a COVID infection. An analysis of a 2-year retrospective cohort studies, including, it looks like a lot of patients, 1,284,437 patients from the Lancet. So there is definitely some problems I'm smelling here. So I wanted to share this paper. If you have a genetic disorder, I would suggest that you really ask your doctor if it's worth these vaccines to take, because you could make something that wasn't present, and you could make something that is present worse.